All right, welcome to My Line of Work. Here we dive deep into the world of work, what people do, why they do it, and how they got there. From dream jobs to unexpected paths, every story matters and every career has a story worth sharing. Today, our special guests are Mariana Chavez and Krysta Dotson. Thank you, ladies, for coming. Go ahead and tell everybody what you do.
Hello, I'm Mariana Chavez. I'm a speech language pathologist.
And I am also a speech language pathologist.
Very cool. And do y'all work together?
No.
No. Okay. Very cool.
Not currently.
Not currently.
Yeah.
We do have a history of working together.
Yes.
Okay.
Just maybe in the future.
Yeah. Yes.
Awesome. So how did y'all get into what you do? And y'all can, whoever wants to go first.
I'll go first.
Sure.
Okay, so in college, I was set to be a teacher. I did become a teacher,
Oh, nice.
but during college, I learned about speech pathology.
Okay.
Didn't even know about it before then. My aunt had 2 children who needed speech services, but there weren't enough at the time, and learned of the need and started looking into it.
Oh, nice. Very cool. So what did you teach originally?
4th, 5th, and 8th grade English.
Oh, okay.
Yeah.
English. Awesome. Very cool. And then how did you get into?
For me, I think I've always had like a love for language. I remember because I also have a degree in interdisciplinary studies or teaching, and it was a linguistics course.
Okay.
And I remember like learning about like syntax, morphology, and thinking like, this is so cool. And my colleagues were like, or my friends were like, this is boring. I was like, this is so interesting.
Yeah.
So it started a little glimpse of an interest there.
Okay.
And then once I was in the field, being a bilingual teacher and having kiddos who were serviced by a monolingual SLP. And I mean, she was doing what she could. And anyhow, and just seeing the need and reaching out to her, being like, what can I do? Like, how can I facilitate or how can I support? So that sparked a little bit of an interest in, and then moved districts to where I was working with, obviously another group of kiddos, and it wasn't specifically the bilingual aspect because it did have a strong bilingual SLP there, but it was more of like seeing the need, right? Seeing that it was a field where a lot of the bilingual kiddos were just not being able to be fully serviced. So.
Interesting. Very cool. So y'all are both teachers, and then y'all transitioned into, okay. And then is it a, so y'all have masters in, or did y'all go back and get a bachelor's in pathology? What was that like?
So it's actually how we met. I got my bachelor's in English and a minor in Christian ministry, and then became a teacher. Went back for prerequisites as I was a teacher, and they called those leveling classes. We both went to Texas Women's University, and it was a distance program, which made it possible to still work.
Okay.
And then once we got our leveling finished, we applied to be in the graduate program, and then we got our master's.
Yeah. Wow. So in order to be part of the prerequisite or get your prerequisites, you had to do like a preliminary process to get elected for that. So it was a risk, because I know that's kind of something that's important to consider. There's going to be so many risks, and choosing a career path, you got to be willing to take those risks depending on how passionate you feel about it. Because for us, even applying for the prerequisite courses, it was not a guarantee that we were going to enter the master's program. We had to apply again. So you could go through taking the leveling courses and still not having the possibility of attaining the master's. I mean, I'm sure you could apply to other universities.
Yeah.
But it was somewhat of a risk, I guess, when you consider, finances or time, or if you have children. But I'm so glad we took the risk.
And there is there is a possibility if you don't get into graduate school, you could possibly become just a speech language pathology assistant, and they do pretty much everything we do except for evaluations and diagnosis.
That's true.
Interesting. Okay. So you have to get accepted into that program,
the prerequisite program, and then the actual master's program. Well, you're right. That's a good point. So let's say someone's thinking, I'm not looking to get a master's degree. You are able to attain an SLPA license, an SLP assistant license through a bachelor's.
Oh, okay.
And then practice, do treatment, you just are not going to have the requisites to diagnose.
And they also can't work with geriatric population or swallowing.
Oh, so there's all the way up. Because I don't know why I think of children mostly.
Yeah. Right. Yes.
Yeah. But y'all work with all ages.
Yes.
So
or you can't.
From newborn all the way to.
Really?
Yeah. Which was new for me too, because initially working in the schools and thinking, meeting that need. And then once you dived into like learning more about the career, it's like, you're doing swallowing, voice disorders, hearing. So there's 9 different areas in speech.
Okay.
Yeah. So
awesome. We'll talk about that. I'm going to check something real quick.
Okay.
What are the 9 different... Okay. I'm traumatized from yesterday. Just want to make sure it's still recording. What are the 9 levels or...
Articulation, language, fluency, voice, resonance, hearing, swallowing, augmentative and alternative communication, and I think cognition.
Yeah, cognition.
So there's people that you help them with swallowing. What is that? What leads to that?
Stroke in adults, but even with newborns who
have difficulty.
Yeah.
Interesting.
Muscle weakness or coordination.
There could be traumatic brain injury also.
Wow. Wow, I'm learning a lot. I think of speech pathology, and I just think, again, right? Like my only experience is in the classroom. So you're thinking, okay, you want to help them. They have a speech impediment or whatever, and you just want to help them. Man, there's a lot involved. That's cool. If I don't go the teacher route, if I want to go straight into speech pathology, what does that look like?
I believe the traditional route is getting your bachelor's first in communication science and disorders.
Okay.
And then leading into your master's.
Oh, okay.
There's also doctorate degrees for people who want to teach at the college level.
Yeah.
But I've never been interested in
that. Are you gonna go all the way?
No. I always say if
you never know.
I don't know. Well, I love research, and with the bilingual population, I think it'd be really cool to dive into that. But I think that would be probably. I don't know if I would want to teach.
I don't know.
Being a professor, but
maybe
I
after
think
the kids are out of the nest, right?
Yeah. So right now, y'all are more interested in doing the work and.
Yeah, I love doing
working
therapy.
With,
I love. I know we'll talk more about that here, but I'm not at the point to where I'm ready for something different, and maybe there'll be an option later on.
Yeah, but there is that opportunity to move. Keep going, doctorate.
Yeah, open up your own business, which we
have talked about that.
Yeah, but maybe.
But you don't need your doctorate for that.
Right.
Oh, okay. Yeah. So if you have a bachelor's, you mentioned you can be an assistant. And then, but to be a speech pathologist, you have to have a master's.
Yes.
Okay. Very cool. Awesome. Is there any like continuing education that y'all do?
Oh yeah.
Yes.
Yeah.
Yes.
What does that look like?
We're required to do 20 hours every 3 years for ASHA.
Yes, I think it's 30 for ASHA every 3 years and 20 for the state license.
Okay, just to renew your license. Okay. And where do y'all get those hours?
You could do them in person, but nowadays I feel like it's all online.
Everything's online.
Yeah.
There's like schools that.
There's different speech pathologists who, they specialize in certain areas like AAC, alternative communication, or whatever area it might be, or school-based physicians, medical physicians who speak, and there's also a conference in each state. Ours is called TISHA, and you can go there and get a lot of hours every year.
Okay. Yeah.
We can have a membership to through speech pathology where they have like hundreds, if not thousands of courses.
Okay.
So yeah.
Cool. And then do things change in that world as far as, because I know. So like I interviewed an accountant. He's like the tax code every year changes.
Yeah.
So he's like got to basically every year not relearn, but like keep up with the changes. Are there any changes, or is it like refresher, or are you learning new things, or what does that look like?
I think it's a little bit of both. Yeah, I think there's always new research, right?
Mm-hmm.
So for articulation norms, there was a new one that just came out in 2020, I think, where now we have more insight and information as far as what the norms are for typically developing children and sounds. Where when we went to graduate school, I think it was up until 8. There's a few more sounds, and now it's like 5. And I think there's one at 6. So yeah, there's new research in that. I forgot what I was going to say.
I think just the dynamic of the speech therapy world has changed a little bit as far as what happens in even politics sometimes and social like society. I've gone into language. You treat pronouns, right? If a kid's not saying their pronouns, and sometimes I've gone into centers where they tell me I'm not allowed to work on pronouns, and I'm like, oh my goodness,
Wow,
so it's very interesting.
Wow. Okay, so all of it. Yeah, that makes sense, because same thing with home inspecting. There's continuing education, but one thing that's required is legal and ethics and standards of practice. Like those are required, and then you can do anything. You could do HVAC or roofing, foundation, whatever. And then those codes change every 3 years. Yeah. But interesting, awesome. So what does I want to talk about like your work, like where you work. You don't have to be specific about the company, but where you work and what your schedule looks like and kind of day to day. What does that look like?
Well,
whoever wants to
current, maybe you can chime in a little bit on the school systems. I worked in the schools also, but I've been doing home health for, I don't know, 10 plus years now.
Okay.
More specifically doing telehealth over the last 4 years.
Oh, okay. So
just meeting that need now where, COVID brought in an opportunity for us to learn about, because I think we had an idea about telehealth and just the possibilities of providing services through that. But seeing that there are so many families that, whether it be rural areas or circumstances where they're not able to receive treatment, and telehealth has provided that opportunity for those kids to receive those.
And so you work from home when you do that?
Yes.
Oh, interesting. Okay. And does that change how you treat versus like in person?
Yeah. No. So interestingly, for me, that was important. Having worked in person home health for, I think it was 8 years, you develop relationships with the kiddos and the families, and obviously you want to make sure that the service is the same, if not better. And I had several families that, after having to do telehealth for whatever reason, they preferred to maintain telehealth versus in person. And I mean, it varies. It varies. We always consider, individual cases. Not everyone is going to be a good candidate for telehealth.
Okay.
But anyhow, I saw the same progress, if not better, depending on the home lifestyle. Some kids do better with having that visual in front of them and having that direct attention versus other distracting factors at home.
Yeah. Okay.
So that was important for me. And I've been able to witness that with multiple families where I used to treat in person, and they had chose to maintain telehealth after COVID.
Okay.
And just kind of see that was important for me.
Yeah.
And the relationships too.
Yeah.
Yeah, you still maintain that.
That's good. So what is your schedule like then?
So working home health, it really is, it's flexible. You have an X amount of kiddos on your caseload, or, patients, and you're able to, of course, work together with that family and see what works best. So it could be, dividing it up Monday through Friday or multiple days. So long as, you may be able to make it work with the families.
So there's just like a required hours for the week or month?
It depends on your status. So, you could be PRN, which I know you've done that before, full-time, part-time. So the company will kind of, based on your status as an employee, give you an X amount of of patients or kiddos to work with, and then just being able to coordinate with the families.
Yeah. Cool. So right now, are you working every day?
So right now it's multiple days out of the week, depending on what the need is. I have heavy days of just doing treatment because for me, it works best to just focus on that. And then I have other days assigned for evaluations. I like to leave a couple of days throughout the week for makeup visits because you're going to have those. And also there's other requirements, writing reports, whether it be submitting evaluations or insurance claims, So there's other areas that are required of us besides treatment and just the evaluation process.
And you have a mix of telehealth and in person?
Currently, I do not.
Okay.
This is recent.
Mostly telehealth.
Just by the choice of the families.
Oh, interesting. Okay. And then what's your schedule like?
So I'm currently working in the school district full time.
Oh, okay.
I'm off right now, which is amazing.
Nice.
Yeah. And I have PRN telehealth kids, and a couple in person that I picked up for the summer that they needed summer care.
Okay.
That's kind of the beauty of home health specifically is it is a very flexible schedule, and as long as the parents are okay with it, you guys can agree to a time together. That's really nice. So
awesome. So you work at a school or you work at multiple schools?
I work at one school.
Oh, okay.
And during the school year, I have one day at home. So the specific school district I work with, we do 4 days of treatment and then one day at home of, if we want to do online meetings or write our reports at home or do billing at home. Yeah. That's where we're at.
Interesting. And then how, at what age range do you work with currently?
So with schools, I'm there with 3-year-olds all the way up to 5th grade.
Okay.
Sometimes 2 if they're coming in for an evaluation to be starting treatment at 3.
Okay.
And then in home health, I have kids, I want to say right now, I mean, I've had them all the way from newborn to 18, I think. Wow. Yeah. And so most home health companies in our area for children take them up to 21 years old.
Wow.
And then they go on to adult home health companies or clinics, outpatient clinics.
Yeah. And then what's the youngest y'all have worked with?
So I used to do early childhood intervention, and that was 0 to 3. So I had some infants. But I wouldn't say that's my area of expertise at all because it was mainly feeding and I was learning under someone else, but I didn't stay in that setting long enough to learn too much. Like if you go into this field, you can specialize in so many different things, which is amazing. Or you could kind of be more general, so.
And you was the youngest you've worked with?
I think the youngest was 17 months.
Wow.
It's really fun though at that age, I think, depending on what the situation is. But it's fun in the sense that you get to really see them learn and grow and just, being part of that. Yeah.
And then what's the oldest y'all have worked with?
20-year-old.
20? Wow.
Yeah. I don't know the exact age, but around that age. Well, no, sorry, I take that back. We both worked and we've worked with 90-year-olds.
Yeah. It was more clinical work for me. But yes, and that was really fun too. Yeah. That was kind of one of those scenarios where you dive into this career and until you're like, oh, I can work with adults too. And honestly, it was required for us to do those hours. So it was like, okay, let's see. And I ended up loving it so much that I told my husband, I'm like, maybe one day I'm gonna go back to the rehab center just because it's fun. Yeah.
That's awesome. Wow. And then with the school, so you follow the school schedule. So when the kids are there, you're there. When they're off, you're off. You get all the Christmas breaks and Thanksgiving. That's awesome. And then do you have like regular PTO? Like,
it's your traditional like 2 weeks out of the year. Okay. But then just being able to have more flexibility just kind of allows for other days. So.
And is that so? If I want to, because one thing I've been learning And one thing I want to share with people is the life that you build, right? You should consider a career for the life that you want, right? Like if you want to be just very involved at home, right? There's some careers are going to be very like a lot of hours, a lot of responsibility. And then for women, especially if you want to stay home when you start having kids, right? And then just considering those things, right? So with speech language pathologists, they can, or is it pretty flexible as far as if I want to, like if I want to do the teacher thing and be on the schedule with my kids, I can do that. Or if I want to stay at home and work remotely, there's kind of,
there's a lot of choices.
Okay.
And you don't have to stick to one choice, like that's kind of why I've worked in so many settings, because when COVID happened, my husband's always been a teacher. And so before COVID, I was in schools also. After COVID, at the time we were really nervous that my son would not do well in school. He might get COVID, and we didn't know at the time if that was going to be really harmful to him. And so at that moment, I was like, okay, I'm going to do telehealth. And I didn't do exactly what Mariana's doing. I did like a contracting company for schools. So it was a little bit different. It wasn't home health. But those jobs are still out there too. Like if you wanted to work in schools but online, you could do that. You could do that part-time. But at the time, when my husband went to work, I would schedule all my clients in the evening when he got home. And then the company I worked for at that time would also say, if the parent's okay with it, you can do weekend visits. So it was evening and weekends. And so we never hired babysitters or daycare.
That's great.
Yeah. And then my experience in home health was the same, so it's very flexible. And I think you could even do that in a medical setting. You could work all PRN jobs. And the way that works, they call you, hey, we have this many patients today. Can you come in? Oh, no, I have to take my kids to the dentist, sorry. But that's the beauty of PRN and home health, I think, is the flexibility. Whereas, now we're not so fearful of COVID anymore. I know my son's going to be fine. So I work in the schools and kind of match their schedules.
Awesome. And then you're also flexible where you can pick what time the sessions are?
Yes and no. Again, I think it depends on the situation. On every family has a certain schedule. There is flexibility, but then there's also just working together with the families. But I was going to say, it came to mind, so with telehealth it is an option, but personally I would recommend being out in the field for a few years, just to kind of, I don't know, just get more of a hands-on. As you've done it for so, I don't know if I would have enjoyed it as much, like coming out of grad school,
going straight into it.
Right. Yeah, I think you definitely need that treatment experience, and almost like you see the need a little bit more intensely. So.
And then does your schedule change when the kids go back to school versus summer?
Not really.
Oh, no? Okay.
No, we kind of maintain the same schedule.
Oh, interesting.
Year round.
Oh, okay.
But if you choose a setting like a clinic or a hospital where you're not PRN, the flexibility probably isn't there as much.
Definitely. I think PRN is probably the best route for a mom who wants to still be, part of home, and then still, go out and do whatever, treat or what's so on. But maybe putting a PRN application at several hospitals or rehab centers to where, let's say, because maybe you can tell me a little more about that. I'm not sure how often you get those calls. And
when I worked, I did PRN at a rehab hospital, and I didn't do more than one. And it was mainly the weekends that they needed me because they had a full-time therapist. But if she were ever sick, they would call and ask if I could go in on a weekday. So
interesting. So what? So if I can work at a school, I can work telehealth, I can work at a hospital. Is there anything else? Any other options? A clinic?
Working at a clinic.
Okay.
Yeah. Nursing facility. That's about it, right?
Or start my own company.
Or start
my own practice.
Yes.
I think they have centers, right? ACI centers also that where you therapist is on site.
Oh yes, like yeah, San Antonio does have one of those, and then ECI is in home or early childhood intervention is what that stands for. It's in home or sometimes at their clinics.
And then I know in the school, typically the teacher will have a concern. How are all the other people being referred? Like, where are they? Like, I need a speech pathologist, or I need help with swallowing, or I need help with whatever it is.
Yeah, the doctors typically, will refer us out. Other times, recently, we've been getting a lot of parent requests, so parents contacting the company, because obviously the doctors are, they have knowledge in so many areas, and maybe it's missed, or maybe I have had a couple of families tell me, I knew there was something wrong. I voiced it. And I think that's where I always tell families, especially moms, whoever's the primary caregiver, follow your gut feeling, because sometimes you are going to hear the doctor say, it's fine. Just give it some time. It'll pass. And then 2 years later, we've lost the opportunity to bridge those gaps. So if there's any moms listening or dads, don't be afraid to reach out and be an advocate for your child, because that happens more often than not. And again, it's just, doctors have knowledge of so many things. But I think if you have that feel as a parent, then So anyway, we've been getting a lot of parents reaching out, requesting that referral.
That's good. Yeah, because the doctors are with them,
right?
30 minutes maybe.
And there's norms that they don't specifically know. That's not their specialty. But I think,
that happened with my son. He was born. He would get a lot of rashes, crying. He would scratch his face. He would start bleeding. Take him to the doctor. And they just wanted to give him like a steroid cream. They were just, and we're like, okay, it's going to help the itching. It might help with the rash, but like, why is he getting a rash, right? So my wife was very like, she was the one asking all those questions, but why, and what's the root, and what?
Root cause,
And so finally my wife was like, I think we need to take him to an allergist. Because they kept recommending, what are the doctors that work on the skin? Dermatologists. They kept recommending dermatologists, and then he just wanted to treat the skin. My wife took him to to check for allergies, and man, he was allergic to tons of things, a whole list. So then my wife stopped eating all that stuff because she was breastfeeding, and within 2 weeks, like, cleared up.
Wow.
Yeah, and then my wife lost a lot of weight. She wasn't eating dairy, eggs, bananas, strawberries, gluten. It was just a long list. Thankfully, he outgrew most of them. Dairy's the one that has stuck. But even now, we've noticed he's doing better. But yeah, the doctor was just like, oh yeah, let's treat the rash. Let's treat the itchiness. And then my wife was like, no, we've got to figure this out.
That's great. I think that's important, that a lot of the times, we feel the doctor knows it all, right? But as a parent, it's important that you're an advocate for them and dive in a little deeper if that's what you're getting, because nobody knows your child better than you. So,
and even if you go to the speech pathologist and they're like, no, he's fine. They're like, okay, cool. We rolled it out.
Exactly. And that's the thing that I always say. It's not going to hurt to just evaluate, and you have a peace of mind. Whatever concerns you have, there's not going to be a loss, but it's going to be a gain either way. Just to evaluate and make sure that you'll be fine.
And then most of what y'all do is covered through insurance?
In the home health field, clinics.
And then at the school, it's just free, right? It's part of the services that the school offers?
Yes.
Okay.
There's a different component, like they have to meet different, criteria. Like in the medical field, it's more following those norms specifically, but in the schools, you have to have an academic need.
Okay.
So it's not medical, is more like a functional, if it's impacting functional communication, daily life, versus the schools, the educational.
And if a teacher has a concern, you come and do an evaluation? Or how does that work?
Typically I would, but the district I'm in is pretty amazing, and they have a whole assessment team for initial evaluations.
Oh, nice.
And so they do all the initial evaluations for the entire district, and I only do re-evaluations. And in the school system, those occur every 3 years unless there's a need before then.
Mm-hmm. And then when you have a new patient, do you start off with an evaluation?
Mm-hmm. Okay. Right. Yeah, start off with an evaluation, and then based, like she was saying, on standard scores or just norms or skills where they're not meeting. We will look at developmental charts, and if they're not where they need to be, then we recommend services, and we reassess every 5 to 6 months. That's what the interest requires.
And then so like, let's say I'm a parent and I'm like, I see this is my concern. Mm-hmm. Do you, like, how do you find if there is a deficiency?
The testing is pretty extensive,
okay.
Depending on what it is. So articulation looks at all sounds and all positions, and mm-hmm. could be at the word level or sentence level, or both. Okay. And then language is a lot longer. It's pretty fast. Yeah.
Okay.
So in home health, we use shorter tests usually, but in the schools, the test can take 1 to 2 hours. Okay. And it looks at, vocabulary, receptively, expressively. Can they understand a whole sentence? What's the complexity of that sentence they can understand or speak?
Yeah.
Wow, that's cool. Following directions, things like that.
Yeah, awesome. And then do you work with only Spanish speaking?
No, I work with both. With mono and bilingual.
Okay. And then you work with English speakers. Mm-hmm. Okay. And then is there a different, in Spanish, is it the same as far as what you're looking for?
As far as language goes, yes. Okay. So typically with language, it's universal. Mm-hmm. When it comes to articulation norms, it is different. Okay. Mm-hmm. Yeah, certain sounds might develop later on versus the English sounds.
Okay. Interesting. Yeah. That's cool. I like language. Very interested in language. Mm-hmm. But I mean, I don't know the things to the depth that y'all know, right? Mine is more like with my kids, right? And they're in the United States, and English for the most part is their first language, but trying to teach them a second language. And it's just, it's interesting to go through that. Because my parents they were like, we know one language, so we speak to you in one language. And then we were the first bilingual, right? And now trying to like carry that. Yeah, it's hard.
Yeah, it's a battle sometimes because English is like everywhere.
Yeah.
Because I know when my kids were younger, like it was like Spanish, and it was like one of them, it was almost like, I don't even know how much English she knows. Like, because like that was like her favorite language, and she picked up on it. But no, she ended up being 50-50 whenever they did a test nice. To Kinder. But anyway, now it's like they understand and but yeah, they definitely need more practice.
Yeah. Oh, I know, it's hard. It's hard to because some of it's on the kids, right? Like my youngest doesn't like Spanish. She doesn't like speaking Spanish. I don't know what it is. Yeah. Right. And then my oldest son, he loves it. He's just very comfortable with it. So each kid is just very different. Mm-hmm. Okay, so what does your day to day look like then at your work? What does that look like?
Man, every day is different, you know. So this past year, I had 2 assistants, and they did most of the therapy. I did therapy with the VIPs, we call them. Okay. So the more difficult kids, you know. Oh, okay.
That's a good word, VIP.
Yeah. So yeah, I mean, you can go in a classroom and pull out a couple kids who just need to work on some sounds, and then the next class you might go to, and it's someone who doesn't speak at all. Wow. So it's very different, and then there could be some behaviors involved. Mm-hmm. But specifically for me, I supervised, I did meetings. We have annual meetings for the kids. So we go over their progress with the parents, answer any questions they might have, recommend new goals. And then lots of report writing and
Okay.
billing.
Yeah.
So
Also, you even work with the billing.
yeah,
Even at the school level.
Mm-hmm.
Okay.
Yeah, they can bill Medicaid, and they do get some funding from that.
Mm-hmm.
So yeah, I mean, not every day is all of that, but
Yeah,
it's a mix of that throughout each day.
Okay.
Yeah.
Cool. And then yours? What does your schedule look like?
So the recommended time frame in home health is 30 minutes per kiddo. So you're spending about 30 minutes, a little over, depending on every kiddo, per session. And again, it's going to vary just on a case by case basis, but typically, depending on the severity, we recommend 2 sessions a week.
Okay.
And again, evaluations for each kiddo, depending, most insurance will request every 5-6 months.
Okay. So. And then are you doing any prep work? And then, so you have a 30-minute session, but realistically, prepping and after, what does that look like?
I mean, I think the one thing, being an SLPs, you have to be very flexible.
Yes.
Okay.
Because you can have like this amazing activity that you think this kiddo's gonna love, and so I have like thousands, no, not thousands, but I have a lot of open tabs ready.
Okay.
Depending on not even like the kid itself, but it's the day,
Yeah.
right? Like yesterday, they might have loved this book, or this, like game, and then today they're like, I don't like it.
Oh, wow.
So you always have to be on your toes and just being prepared. And when I was doing in person, it was like they called us like Mary Poppins, because we have our big old bag with like our trinkets and just being prepared.
Okay.
And just being prepared and being flexible to meeting their interest, because if you don't have their interest, you lost them. So and again, just establishing a good rapport with those kids, because if they know that they have to do this, you lost them.
You have to make them feel like they're leading the session. Honestly, you have to make them feel like they're in charge, even though they're not. And that takes some time to get to that point.
Yeah. You give them the illusion of choice. I do that with my kids.
Oh yeah, 100%.
Yeah. I always tell my wife, because my wife is she's real picky about their clothes. And she used to be like, you're going to wear this. And I'm like, give them the illusion of choice. Like, pick out 2 things you don't mind them wearing. And they're like, pick one. And then they're like, oh, that one.
And they love it too, because they feel like they're making the choice, like they're in charge. Yeah. But they're not.
Very cool. Man, I had a question while you were talking. What have you ever ran across the situation where you're working with a kid and then just they're not progressing? Have you ever had that?
I have.
Because y'all talk about reevaluating every, and then what does that look like?
It's difficult. A lot of times the kid I'm thinking of, she was pretty young. She was about 6 years old, but she had already had cancer. She had Down syndrome, but she had 2 things going against her, the effects of the chemotherapy, and then, having the syndrome and just the language impairment and everything. So it was very, very slow. And when you don't see a ton of progress outright, you have to find just something, and take baby steps and really elaborate on that when you're writing a reevaluation to the insurance companies, and also emphasize there's still very much a functional need. They can still benefit from our services. But I've had a couple older ones that, they've been in therapy for years, and we're kind of still working on the same things. But if we just stopped, they would regress, So it's not just about progression. It's also about maintenance sometimes.
Okay.
And not wanting to see that regression. But
and it happens. It's inevitable. It happens because, unfortunately, like she mentioned, with insurances, for whatever the reason, there's holds, and even as little as 2 months. I recently had that case where, because there was a hold in services, they were not receiving it for 2 months, and it's like reevaluating, like gut wrenching, like no, like we had made so much progress. So I would say, that's very, very typical. So I'm like always saying frequent and consistent attendance therapy and implementation. I think importantly with home health or and in the schools also, whether it be the teachers or whether it be the parents, just kind of following up with whatever um, interventions or strategies we're offering them to them, just so that can continue to help us maintain it even when we're not directly giving the service.
Yeah. And then are you guys given like standard benchmarks of progression? Like if we're working on this skill and obviously the goal is, or we'll call it proficiency, is here. Is there like a standard, like, okay, this is progression and this is progression? Right? I don't know if y'all understand that question.
It kind of depends. You have to know the kid and the extremity of what they're up against, you know? And so you are the one who writes the goal. So if you feel that a child, I don't know, might not speak in forward utterances in 6 months, then you write the goal for 2 words. You know? That way you can show that there was progress. And then oftentimes I'll write the goal as, we'll do forward utterances 80% of the time over 3 sessions or something like that, or at an average of 80% over 3 sessions. So it's not just one session they did 80%, they mastered it. That can't be. You know, it has to be over a certain amount of time.
Yeah.
And then, I mean, that's how I would look at most, even the school setting. That's how I would write it.
Yeah.
So maybe it's different for home health.
Yeah, no, it's very similar. So you have developmental norms. What is 6-month-old, 12-month-old, 15, 18-month-old, and so on. After about 2 years, we'll look at on a year-by-year basis as to what a typically developing child should be mastering. So when we complete the evaluation and we see the areas that they're lacking, based on home health functional needs, what do we need to focus on primarily now? And then that's where we derive our goals to see, okay, they're not using 4 words, or they're not even able to recognize items in their environment or objects. Are they able to understand words like "do you want to eat," or are they able to verbalize? A lot of the times there's kids that do a lot of gestures, so like ow, because they're missing, they need the language to be able to verbalize a want or a need. So just so for us in home health, every 5-6 months you reassess and you consider the current status of the kid and where they're going to meet X goal within the next 5 months, because insurance is looking to see progress. And if you write a goal that's going to be too high for them, they're not going to be mastered. So then the insurance might not like that, because they're looking to see that they're mastering whatever goals. So it does get tricky with figuring out where, just what to look forward for each kiddo for each goal.
Yeah.
And that they'll master that.
Yeah, and I'll try to ask parents to, what's their biggest concern for their child. And usually it coincides with whatever we find in the evaluation.
Okay.
But if it doesn't show up, like sometimes yes, no questions are barely on the evaluation, and the parents like, well, I never know if they want this. They never say yes. They only say no. That's a big deal,
Yeah.
And I'll definitely make that a goal in addition to the ones that came from the evaluation.
Okay. And are you giving parents things to do in between sessions?
Yeah. So with home health, especially working with the young population, they're there. They're next to the kids, so they're able, which is what I love about home health, that they're able to directly see what to work on. Because if I wasn't a speech therapist, I wouldn't know what to do, right? But then if you see, oh, that's something simple, like I just need to ask, oh, do you want milk or do you want juice? Or little things like leaving things out of reach for the child, otherwise he can get what he wants. So it's a lot of education that goes into working in home health and being able to be part of that, being part of that growth, not only for the patient themselves, but I always say to the parents, like, we're a resource for you all too. And just being able to provide that that help, I really enjoy, because we don't know everything as parents. So it's always helpful to just have some guidance. So yeah, we have different interventions or things that they can help with throughout the week, because I'll tell them I only see them for X amount of time, you're with them the majority of the time. And you do see that big difference when you have parents that are supporting, who's following through.
Yeah. Is there ever advice? So like the whole nature versus nurture, right? Like, is there ever advice like do these exercises, but also minimize screen time? Make sure they're going outside. I don't know, whatever the not so much like specific things to work on, but like, hey, these are just, I don't know.
I think one of the biggest ones for the youngest population that we heard in grad school was to narrate everything. And that still stands true now, maybe even more now, because screens are so prevalent in the kids' lives, And I get it. I mean, I'm a mom. My kids, I have 3. I need to shop at HEB. Right. Baby's crying. Here's my phone. But don't have it on all day long, and don't let that be. Don't let Miss Rachel be their teacher. Love her, hate her.
Love-hate relationship.
Yes.
Yeah. And are there things that you guys have changed in your parenting due to your profession? Like, because I know this, I don't do this?
Well, I just came from the dentist, and my daughter's still on a pacifier, and it's hard. I sympathize with moms because, we can give that advice all the time, but they know their babies, and I know I need to get my baby off the pacifier, but she is a difficult one, and she's crying, and that's the only thing that'll help. But, I know I need to do it, and I'm going to do it. But little things as far as the speech world goes, I would say talking a lot more. I mean, when my babies were all toddlers and the one I have now as a toddler, I read them books all the time. I don't know that would have changed because I was a teacher before, but I'm very elaborate with the language and trying to point out like those higher level vocabulary words that I want her to learn, just little things like that. So what do you think?
Yeah. So I was pregnant with my oldest when I went into the field. So if I had to think about it, a lot of what Chris has mentioned, just not, it's really tempting as a parent when, they're so little and, they're just grunting for whatever. And I think maybe, I don't know, so I would maybe say that I consider like, okay, which one do you want? Do you want this or that? So again, with the choices, just a lot of playtime. Playtime is important. Don't underestimate playtime. Playtime brings on so many skills from not only language, but problem solving, cognitive, and just being
connection.
Connection. Pragmatics, which is social language. As far as feeding goes, I think, not letting them drink from the bottle until they're like a year and a half. Because through grad school, we learned that when they're about 8, well, depending on the kid again, 8, 9 months old, like they're able to sip liquids through a straw. So it was like, what? Like they don't need to go from the bottle to like a sippy cup and then the straw. It's like, no, you can just go straight from the bottle to the straw. Unless there's, again, concerns with feeding, then obviously that's something else. But I would say that was something, the pacifier one.
Yes. Guilty as charged.
My oldest loved the pacifier. But for me, it was more of like, I'm going to hinder her from developing muscles.
I know.
So I was like, it's just my first though. There's a lot of learning that went with that. But I would say that.
Did you find yourself correcting their sounds? Because I do that all the time.
Yeah, I forgot about that. Yes, I did. Yes.
You're not going to have a lisp.
I do have my child. That's exactly. Now that I think about it, I did have one where we kind of did a little bit of informal therapy.
Yeah.
Try it again.
That's cool. That's good. I think it's good. I mean, obviously, you're experts in that area, right? So you notice something, you're like, oh, let's fix that. Yeah, that's cool. Have you noticed in your field that y'all get more referrals from a certain gender? Is it more typical for you to have boys or girls, or is it just pretty even?
I would say more boys.
100% more boys. Yeah, I'm trying to think how many girls. I have a couple.
And is that okay? So I heard a comedian. It was really funny. And I was laughing because her oldest is a girl, and then her second is a boy. So this comedian, she just says it in a funny way, how her daughter did everything much earlier than her son. Like she walked earlier, she talked earlier, like just very. And then her son is born, and she's like expecting him to walk at a certain, like basically the benchmarks that her daughter hit. He's like, why isn't he walking? Why isn't he talking? He just grunts, right? Like, and she's like, I think he, like there's something wrong with him. And then later he just finds out, like she goes on to say like, girls are they just develop faster. She was like, but I thought there was something wrong with my son. And I'm laughing because it was the same thing with my kids. Like my daughter from a really young age just spoke really clearly. She walked sooner than all of my kids. And then the boys come along and it's like, I wouldn't understand him. Like I'd have to ask. So my son would tell me something and I'd look at my wife and she'd be like, oh, she's like my translator because she's with them all the time. And I'm like, I don't understand what he's saying. I don't know what he's saying. I don't know if he's speaking English, Spanish. I don't know what.
Chinese.
Yeah. And so I have noticed that as a parent. And so do you think some of the referrals for the boys are, is it
I mean,
because
I would say
it's their
with the
boy?
major diagnoses that we see, autism, it's more prevalent in boys.
Okay.
And at my school specifically, I work with mostly autistic children.
Okay.
But then also fluency, like stuttering, it's more prevalent in boys in my experience.
Interesting.
But with autism, if we do have a girl with autism, usually it's more severe than what we see in the boys. So it's kind of like, as far as articulation, I would say that it's pretty even. Right?
Okay.
Yeah. I mean, there is some research that supports that boys, certain sounds do develop slightly later than girls. I think that, and that's not like a blanket statement, but I think overall, like, girls, we do have more of an intrinsic or an interest for talking. We're more so but there are still norms that kind of help us identify a true speech and language impairment rather than like, oh, he just doesn't like to talk. So that's where like the key area is having an assessment that's going to cover different areas, because it's not the case of like, oh, he's just not interested in talking. Like there truly is a language delay.
Interesting.
I have a boy and 2 girls, and my son was a late talker. So
really?
It's an interesting topic to think about.
Yeah, it's interesting.
Now he won't be quiet.
Oh, really?
Yeah.
That's one of my boys, Daniel. He likes to talk, which is nice. But I think it's also even that's developmental, right? Like they go through a stage where they're just like talking.
Yeah.
And then they go through a stage where they don't want to talk to you.
Yeah.
That's where my oldest are going.
I was gonna say teenager.
Yeah. Like,
let's need/want something.
Yeah. How was school? Good.
Yeah.
Anything interesting? No.
Yeah.
But then with their friends, they're like, oh, this happened, and this happened. And I'm like, well, I asked you if anything happened, and no. Yeah. Are there any pros and cons that y'all can think of for your work? Things that you like about your job? Things that you're like, not that you hate, but it's like, these are things to consider, right?
I would say the cons, no matter what setting you're in, is the paperwork. I mean, it's not awful, but it's not great.
Yeah.
But I feel like that's with any job that has paperwork involved. Technology is making it easier. We used to have to do at our agency that we started with. It was like all on Microsoft Word, and now we have a system that it has some little templates for you to select, and then you can modify. So it's gotten easier. Yeah,
that's good.
I think for me, definitely support that. It's necessary, but sometimes it's like more exciting to work with kids who do treatment. I think barriers working in the home health field, and you can relate. It's just sometimes insurances, and I think what makes it hard is, the individual, families that are, they know their own kids, and you have someone saying, no, they don't need to receive services anymore. So then it's being able to, I guess, again, paperwork, right? Prove on paper the need for services. The other barrier I would say with home health that makes it hard is having, again, it doesn't happen too often, but having families that don't see the value or think of therapy to be what it really is. So again, going back to the consistent, um, you know, attending or frequency of services, and how, and it does take for some parents when there's a hole in the service, we're like, oh wow, like he regrets big time. So not having that support sometimes, not having that follow through with strategies, or you're having them do, it's like,
a lot of times parents see what we do as just play, just play, that's what it's called. And like she said earlier, play is so important to language development, and so we might be playing with your child, but we know how to play.
It's very intentional.
When it's interesting for them. So, and a lot of the times, another reason why I love play is they don't realize that they're working on certain goals. So for them, like, I'm just here playing, or hanging out, with mom, and and then the relationship that they develop with mom and dad, and or grandma, whoever is taking the time to engage with them in playtime. But it's so fun for them; they don't realize that we're actually addressing goals while we're playing with them. So that's always cool, right? We're having fun while we're learning and being able to help them.
Cool. And then the pros obviously is the impact, working with the kids. Very cool. You mentioned technology. Is there any artificial intelligence in the field? Any of that?
I'd say it's definitely moving in that direction, in a good way and a bad way.
Okay.
I don't know if you heard about it, but there was an AI speech therapist. It wasn't an actual person who was correcting children's sounds on the computer.
Okay.
And I can already tell you I don't agree with that.
Yeah.
But it's out there. And as far as paperwork, I mean, you can use ChatGPT, and I would say as a warning, not to depend on it. But if you don't know how to say something professionally, maybe you can put it in, help me say this professionally. But I don't know.
Yeah, the only thing that comes to mind besides that, I know there's apps out there that swear or testify that they're going to help your child improve speech services, and it's fake. It's fake. And I know that as a parent, you get desperate and you want to provide some help or intervention for your kids, but always consult with your doctor to give you a referral for a speech language pathologist to do an evaluation, just because the data doesn't, it doesn't show that to be effective.
Yeah, it's true. It was the same with language. I was learning German on Duolingo, and I'm like, man, I'm doing really good. And then I went to an inspection, and the homeowner was German. Okay. And then I tried my whole thing, right? Like, as soon as she talked back to me, I was like, I do not know German. Yeah. And I tell my kids that, right? Because they're on Duolingo, right? And then it's I'm at work. I can't sit with them all the time, so it's nice for them to have Duolingo. But I tell them, like, I'm here, like, just talk to me, like, I'll talk to you, you talk to me, like, there's no better way to learn language than to speak with someone that knows the language. And so it's probably the same with that. Like the computer tries to emulate what you're doing, but it's not. I don't think it could ever replace what you guys do.
Yeah, and the computer can't play with your kid.
All of that. Yeah. That's the thing with AI, that there's some people are scared that it'll replace, and there's some things that it can replace because of efficiency, but like the physical, like it doesn't. We're never gonna trust it.
It's not natural, it's like it's not a human. So as natural as a make these AI robots look like. It's like we still know what humans look like. Yeah. So I think even for kids, right? They see that and they get frightened by that. I did see that where there's an AI robot that's trying to provide services, and it's a little creepy. Yeah. I mean, even for me as an adult, and kids, I mean, they're kids, but they know.
Yeah. That's funny. Very cool. Are there any other trends that y'all see that has changed since you started? Anything that?
I would say the biggest one is telehealth. Yeah, we experienced that change together, and it's not going anywhere. You know? So I think if anything, it'll take off more.
Well, there's research. I don't know. We're part of the American Speech and Hearing Association, so we get magazines on a bi-monthly basis, and there's data that shows in-person services for specific, individuals in person in telehealth. And I was really like impressed to see that again for some of them it was higher telehealth. So the research is definitely there. So I love that we have an opportunity again to service another need.
Yeah, and it just makes the service more accessible, right?
Yeah. And then you have again family dynamics, right? A lot of the times I had families that have multiple kids, so it's like taking this one child to do a 30-minute session at a clinic, or even at home. Like when I was doing at home, it was like, and so they go to a quiet space and they're able to attend for those 30-40 minutes. So
that's good. Very cool.
All good things.
Yeah, that's awesome. What I had a question that I was gonna ask you. I forgot. Anything else that y'all can think of as far as what y'all do? Is there something that y'all do that maybe people wouldn't think you do?
I think the swallowing voice is the one that we get a lot of that. Or sometimes people think that you have to, get a different degree to work with an older population and vice versa.
Or even different settings.
Right.
Yeah. But swallowing, I'm always hearing people say, I didn't know you worked on that.
Yeah.
And then infants, probably. So,
And how do you work with someone that doesn't speak like an infant? Like, how do you?
They look at the suck swallow reflex.
Okay.
And they try different approaches with different bottles, giving the mother different advice.
Okay.
Different thickening of the liquid possibly could help them to not aspirate. That's the biggest thing is if they're aspirating, how to get them to stop aspirating. They use what's called a modified barium swallow study, where they put barium in the liquid, and then it's kind of like an X-ray of your swallow. And they watch it go down and see if you're aspirating.
I've seen those videos.
But I haven't done that in years. I think it takes a special person for each setting. And I had one swallow study where an older man, we did it with a pill, like a large pill, because they had to take a lot of medicine, and he got it stuck. And it was minutes, and it just terrified me. And it eventually came out, but
did y'all have to try to get it out, or what?
We gave him different strategies to use, like coughing and putting his chin down.
Oh, he was still able to breathe.
Yes,
it was just
the vallecula is what it was called. See a little gap in there called your vallecula. I remember that word in grad school. Your vallecula, and it would not come out though, and we were just like, oh my goodness. So I was never super comfortable with swallow studies, but there are people who love it, and that's all they do. And we also work with picky eaters, so it might not be their swallow, it might be their approach to food. I'm more comfortable with that.
More sensory based.
I've had a couple children with that I've worked with, and we made some good progress, but it's definitely trying to connect with the child and know what they like. And
So when does it become so? Like my kids, right? My wife is always like, she always serves like a protein, vegetable, and then like another side, right? When does it go from I don't like certain vegetables to I need someone to come in and help? Like, I'm picky. You mentioned the word picky eater.
Yeah.
Like to me, all kids are picky eaters, but when does it kind of cross that line of like, we need to work with them?
I think definitely when it affects their nutritional intake.
Okay.
So if they're not getting protein, I'm thinking specifically of one child I had. She just wasn't eating any protein.
Oh, okay.
Yogurts, meats, nothing. It was all chips or crackers. So it was,
I had a friend whose daughter would just eat cheese.
Oh my goodness.
Just cheese. And then like we would have like tostadas and then she would just get a thing of shredded cheese. Wow. Just a plate and then just and I'm like,
she's a picky eater.
Yeah.
Yeah.
Yeah, I would see that. I'm like, whoa. Yeah. But me as a parent, I'm like, no, no, you're gonna eat everything, right?
Yeah.
And
you'll see a gag reflex a lot. Like it's not just I don't want this. It's like their body is
like
having a physical reaction.
Oh, wow.
Yeah. Sometimes they throw up if they even get near the food.
Really?
So, yeah.
Have you ever worked with?
Yeah. So I would also, I guess, more the motor aspect of it, something to just kind of keep an eye out, if there's a kid who's been chewing on that one piece of food, whatever that may be, for like minutes, and it's just like there, and they're not mobilizing it from side to side, or it's a chunk of meat and it's just stayed a chunk of meat for like the last 3 minutes. A lot of the times I saw kids eat or try the piece of meat and then chew on it for a little while and then spit it out. Things like suctioning on a straw and then we're seeing drooling or not being able to hold a suction. Just more like I've had more like sensory motor kiddos that I worked with.
Wow, that's awesome.
Teaching them how to chew because sometimes sensory goes along with motor, so whatever message they're receiving sensory wise prompts them to not want to chew, so they're not chewing, they're not using those muscles, so you literally teach them how to chew and how to make those motor movements within the mouth and just throughout the mouth.
Yeah.
A lot of times kids who are coming off of it, like being tube fed, that are having to learn how to eat. Like they might not necessarily be a picky eater, they've just never done it.
Yeah.
But they have the capability now.
Bringing alertness to like the muscles, because working, I think it was at the rehab hospital where, so just bringing alertness, cold treatment or, we did lemons just to kind of bring alertness to.
There's vital stim therapy, which is like electrodes that they put on their muscles to help elicit a swallow. It's very complex. Like I have so much respect for my feeding therapy friends. Yeah. It's just I don't know, it scares me. Yeah. I hate to misdiagnose or,
but you have to have a passion for it too, because I know there's so many therapists that are like, I could not do articulation or language or,
the settings in the rehab hospital. Yeah. I could never work with children.
Right.
Oh, okay.
Yeah. Well, that's the good thing about your field, that you can, there's a range. Yeah. That's really cool.
Yeah, because when I was at the rehab hospital, there was a therapist that had done home health and for like 10 years, and prior she did schools for 5 years. She's like, I need to get back into just working with adults, nothing but adults. So
really?
I mean, there's
advice to others: you need to like children or adults.
Yeah.
And be very patient and be very flexible. I think patience and just persevere.
Yeah,
persevere, whatever it is, because we'll get there.
Yeah. Well, let's get into that advice. What advice would you give to someone wanting to, be a speech pathologist?
Kind of piggybacking off what we just said, I would say to observe all age ranges, all settings, because you might surprise yourself. Right. You might think, I want to work with children, and then you get to that hospital or nursing facility and just have a heart for the geriatric population, and also seeing the different therapy techniques at those ages, for sure.
Okay.
So expose yourself. There's so many fields, different settings. the actual master's program is intense.
Mm-hmm.
So I think it's not impossible, but it is something to consider.
Yeah. Yeah, you did it when you were pregnant. I did it when I was
They
pregnant.
told us, don't get pregnant, don't have any babies.
We both did
got
not
my letter of
listen.
acceptance
I didn't
after
listen.
I got a positive pregnancy test. So it's like, all right, Lord, let's do this.
Yeah.
Nice.
So again, not impossible, but just kind of consideration.
It's gonna take some work, but it's not
Yeah.
forever, you know, and you can do it.
Yeah.
So
Is this a woman-dominated field? Is it mostly a lot of?
Yes.
Yeah.
I think we
men
had
in the
like
field.
1 or 2 in our class. Men.
Yes, we had 2, I think.
Yeah, 2.
There's like 4 in my district out of over 100 therapists.
Oh wow.
Yeah.
And what I've seen for the male SLPs, again, there's so many options. They've gone into like owning a business or different fields. Being
Oftentimes
professors.
speakers.
Mm-hmm.
Yeah. So
Interesting. And are there opportunities for someone that's looking into your field, like internships or volunteer opportunities for them to really like see hands-on?
I would say call different clinics, different hospitals to ask.
Yeah.
You'll definitely get that opportunity if you're in a program because the college will find those for you.
Okay.
But before, sinking some money into this,
Yeah.
I would definitely call a therapist and ask to observe. Usually they just have to sign a confidentiality form,
Okay.
so.
Yeah. Very cool. Awesome. Well, I have some closing questions. I don't prepare my guests for these.
Okay.
What was told to you growing up as far as work? Like what advice was given about like careers and working? What was that like growing up?
My dad was real big on the word initiative.
Okay.
When I was growing up. We had a little like word in our office that said initiative real big, and then we had the definition under it. And
Awesome.
basically take initiative in all that you do.
Yeah.
And that has always stuck with me, no matter what field you're in. And then my mom, and I don't want this to turn into like a women's thing or whatever, but my mom told me early on not to ever depend on a man. And I think that is good advice to an extent. I'm married, my husband could support us, but you never know where life will take you. Like what could happen one day, and I think this field, like you could sit on this degree and be a mom most of the time, and if something needed to happen, you can bring in some income for your family. It's good. There. That's good advice. So
that's true. My the rule in our house growing up was you don't move out until you get married. Well, my older sister became an electrical engineer, living at home, didn't have a boyfriend, making more money than my parents make combined. Wow. She wanted to buy a house. And my dad was like, no, you're not gonna go live by yourself. Finally, they let her buy a house, but I had to go move in with her. Oh my goodness! Like, okay, but you're taking Lewis.
That's funny.
So I lived with her my senior year in college. Wow. I lived with my sister, but she was always at work. I was either at school, work, or with Josette. So I wasn't even there. Like, we barely saw each other. But yeah, my dad was the funny thing was. He gave her the same. He gave my sisters the same advice. Like, you guys are gonna go to school. You're gonna get a career, and because if you don't get married, like you can provide for yourself. But then it was like, I want to buy a house. Like, no, you're not married. Like,
that's funny.
That's funny. What about you?
I think work directly was like just having a strong work ethic. Working hard, being honest. And all that you do. The other one I would say is like you're gonna go to college. whatever you decide, you're gonna go to college. And it was always like better like working hard and just having that vision like to have a career that I wanted to pursue.
Okay. Did your dad say you have to go to college?
No, I always wanted to. Okay. And I think maybe they would have said that if I hadn't expressed that desire to go.
Okay.
But my parents were both military, and we moved around when I was young a lot, and so I never had a desire for the military life.
Yeah.
So yeah, I think it was just kind of this known thing, like she wants to go.
Oh, okay.
Yeah.
That's good. Because we're from that generation,
Right.
like college.
Yeah.
Like if you want to be successful, you have to go to college.
Yeah.
Yeah. And then now, looking back, because I think that's part of the student loan problem was the parents were like, at any cost, at all costs,
Right.
because then you're going to make enough money to pay it back.
Right.
And so but then, 20, 30 years later, all these kids have student debt. And a lot of them, I have friends that are still paying off in their 40s, still paying off their student loans. So now this generation's like, college isn't for it. There's even like a shift of like, college is a scam, And I'm like, I don't think so. I think there's still a lot of value depending on what you study.
Right. 100%. Yeah.
Yeah. It really depends on the career that you choose. What about, how would you define success? It can be work related or just general in life. How would y'all define success?
I think that answer has changed for me since becoming a mother. But I would say time with your family, for me, is the most important thing. I would never do this if I had to be away all the time.
Okay.
So work-life balance, maybe. Might be, while still supporting your family in a good way.
Yeah.
So that's.
Yeah, definitely. I mean, I think like being responsible, financially responsible, but there's just, no price per se that goes along with be part of the growth of your family, and just being involved. And again, individually, everybody has their preference, but personally, I think, and then being able to, be part of the growth of the kiddos and be involved with your spouse. And making time for one another.
Yeah.
Because there's always going to be opportunities are going to try to sway you away from that.
Yeah.
But
I think when we both first started, we were very career minded. We weren't moms yet.
Okay.
Yeah. And it's not that the career isn't important, but it's definitely not number one for us. Yeah.
That's good.
Yeah.
I like that. Very cool. Yeah, my daughter was already talking about marriage and kids. And I'm like, that's good. I think it's good. That's good, man. Because there was a lot of young men in our church that I noticed like didn't have any urgency to study. They didn't even want a driver's license. And I'm like, y'all need girlfriends. Like once you get married and kids, like it gives you a reason to like go and work hard. And
100%. Yeah.
Yeah. So I'm like, that's good. So I tell my daughter, I'm like, that's good. I'm like, just do it right. Yeah. But it's good that you want to have, get married, have kids. I think that's
those
beautiful.
Ages or those years, I should say, are just going to go by so fast. And I think that we love our career and our jobs, and Lord willing, there'll be time to dive into other areas. Like we said earlier, like maybe we'll build a business together. That's something that we always talked about.
We've made logos.
Oh, really?
Hey, what do you think of this one? Even though we're probably not going to do this anytime soon.
Yeah.
But I think the stage of life that we're in right now. I mean, not to say that it's impossible, but again, just kind of
our values are different.
Our values, 100%.
Awesome.
Yeah.
Well, if you ever do it, y'all can come back and this is how to open your own business. Yeah. Awesome. You kind of answered the last question. This is a question that I added recently. Is what lifestyle does your career afford you? Right. And I think y'all answered it with, you can really, like, if you want to work a lot and make a lot of money, you can do that. If you want to, have that work-life balance, you're able to do that. Like, there's a lot of options in your line of work. So, I like that.
Going back to what you said about student loans, we both got pregnant in grad school, but I was going to say, if you are in grad school, you're not married, whatever, work at a home health agency and bust out those visits for a year or two and pay off those loans before you get married. Yeah. That's what I would do.
Yeah. And because what do you need to work where you mentioned working? Do you need any?
Like home health?
No, you mentioned while you're getting your master's to work at a clinic. Is there any prerequisites to be able to get a job like that?
So if you're getting your master's and then wanting to work.
Yeah, she mentioned work. Where'd you say to work?
I would do a home health agency because
Yeah,
you can
home
pick
health.
up as many clients as you can.
And that you can do before you have your master's?
As an SLPA, you definitely can,
Oh, okay.
but
Okay.
probably not possible while you're studying. But once you have that master's, I would get it done. Yeah.
Okay.
I've heard of other therapists doing that.
Yeah.
Yeah.
So what can you do with the bachelor? What was the bachelor's you mentioned that y'all get if you were to go to directly?
Communication science and disorders.
Okay, that one. Can you do anything with just that? Yeah.
You can do a SLPA position.
SLPA. What is the SLPA?
So being an assistant to an SLP, where you're able to.
Oh, okay, assistant. Okay, it just adds the A. Okay. Oh, okay. Do y'all know any of those that I can interview?
I do. I have.
Oh yeah.
I have a couple of assistants on my license right now.
Okay. And the only, I don't want to say the only difference, but the biggest difference is they can't treat.
They can
or what does that look
treat
like?
Children, and they cannot do feeding.
Okay.
They cannot evaluate.
So give a diagnosis.
Okay.
But they can provide input for sure. Like a lot of times they'll treat these kids for way longer than we do. We have requirements to supervise them, but they're with these kids longer than we are, and then we'll come in for the eval and they'll give us kind of like a.
So they're under an SLP.
Right. They're given the treatment
and they're given
plan.
Okay.
Yeah, they're given the treatment plan. They follow through with it under the supervision, of a fully licensed therapist. And whenever you're doing evaluations, I know that it's important to kind of bring in that feedback since they know the client or student a little deeper than you do.
And have y'all ever had an SLPA work under you? Yeah.
I haven't personally.
Yeah, I've had 3.
Oh,
no,
okay.
4. I've had 4. Yeah.
And did any of them go on to become?
Not
SLPs?
yet. One of them is thinking about it.
Oh,
yeah.
Nice. Interesting. So there's a lot of options with y'all's line of work. Man, that's cool. I like it. Any closing words or remarks?
It's an amazing career. I'm just really thankful that that the Lord kind of opened us up and insight into even deeper understanding of what I knew about it. Yeah. It's very rewarding. It's challenging, but I wouldn't have it any other way.
Yeah.
That's good. Well, thank you for coming on, and it's gonna help somebody. Yeah, I just want to again just expose people to what's out there, and then also like a lot of times we think we know what people do in certain careers, but then having someone come and say I do, and I wrote this down earlier. It's not just working with the kids, right? There's evaluations and there's paperwork and there's insurance, and it's you're getting the whole you're getting the whole picture.
Yeah.
So like when I interviewed Juan, it was funny. I asked him, so how much of your job is actually fighting fires? And he was like, maybe like 25%. I'm like, what? I'm like, you're a firefighter and you don't fight fires all the time? He's like, no. He's like, a lot of it's medical. I'm like, what? And then he actually said that he considered himself a problem solver. I was like, oh wow, that's what my siblings say that are engineers. They're like, oh, we're just problem solvers. I'm like, that's interesting. He says that. So, well, thank you for coming on.
Thanks for having us.
Yeah, of course. We'll go ahead and wrap this up. Thank you for tuning into My Line of Work. I hope today's video inspired you to find the work you love. If there's a career you're curious about, drop it in the comments and we'd love to feature it. Hasta la próxima. Thank you. Awesome. How long do you think that was?
I was going to say 2 hours.